India's climate crisis. Children bear the brunt of rising vulnerability. India, while a global economic powerhouse and a leader in renewable energy, faces a harsh reality. Climate change is disproportionately harming its most vulnerable population, children. A new study confirms that children in districts hardest hit by climate impacts are at significantly higher risk of malnutrition, stunted growth, and limited access to health care. This isn't merely a health crisis. It's a systemic issue that threatens progress towards global development goals. Climate change exacerbates existing inequalities. Researchers, publishing in PLOS 1 in late 2025, found a clear link between climate vulnerability and poor health outcomes. Even after controlling for factors like maternal education and healthcare access, districts exposed to extreme climate conditions consistently underperform in key health indicators, including child stunting, wasting, and underweight rates. These findings align with broader global observations linking climate change to deteriorating maternal and child health. The study highlights how climate change actively disrupts healthcare delivery. Harsh geography, lack of transportation, limited services, and financial barriers already impede access to quality care. Climate change intensifies these problems, straining health systems and potentially driving up costs in low- and middle-income countries, LMICs. Regional hotspots of climate vulnerability, the data reveals stark geographic patterns. Rajasthan, a desert state in the northwest, has the highest concentration of highly vulnerable districts. Jharkhand, Chhattisgarh, and Uttarakhand follow closely behind. However, the vulnerability isn't uniform within states. Districts within Gujarat, West Bengal, Uttar Pradesh, and Uttarakhand show considerable variation. The entire state of Arunachal Pradesh in the northeast is considered highly vulnerable. This underscores that climate impacts aren't limited to specific regions, but cut across India's diverse landscape. The need for climate-resilient healthcare. Researchers emphasize the urgent need for proactive adaptation. Tracking climate disaster impacts and integrating them into health planning is critical. This includes building flood and heat-resistant infrastructure, ensuring adequate medicine stockpiles, and training healthcare workers to respond effectively. Effective investment decisions must consider local climate vulnerability when allocating resources. Ignoring these differences will hinder progress towards Sustainable Development Goals, SDGs. Progress and persistent disparities. Despite these challenges, India has made strides in maternal and child health care over the past decade through initiatives like the National Health Mission. These programs have reduced financial barriers to healthcare and incentivized hospital births, leading to lower child mortality rates. However, progress remains uneven. Deep health disparities persist in underdeveloped regions and among marginalized communities. Gender inequality also plays a role. Female children under 5 are more likely to suffer from malnutrition than their male counterparts due to ingrained biases in some households. Ultimately, addressing climate vulnerability is no longer just an environmental issue. It's a fundamental requirement for protecting India's future generations. Failing to do so will not only delay progress towards health and development goals, but will also exacerbate existing inequalities, leaving the most vulnerable further behind.